5 minutes for this is Dr. Bhupesh once again from Dr. BKM Institute. Just going to take your 5 precious minutes for this letter. Again, this letter will teach us a lot of things. Again, letter is simple. Write a letter to Mrs. and Mr. Johnson of this following discharge of their son Sammy from the hospital. So I will like to tell you a few things about these letters, and also we will understand by this letter in a better way. So basically what is happening that Sammy Johnson is one of the person. He had admission on 2nd, 3rd. That means he just had a stay for 1 day. And looking at the age, 2015 minus 6 is 9 years old. So he's 9 years old, stayed with you for a day, and he came with distal radius fracture, and you did some x-ray of the list, plaster cast was applied, and all those stuff were done. Paracetamol was, ibuprofen and other painkillers were given. Then you gave advice to the parents. So it is basically a kind of an advisory letter. ये एक advice letter है, तो आपको advice देनी है. Lives with his parents, younger brother, ये सब उसकी social history है. तो आपको इसके बारे में ऐसे letters में बिल्कुल नहीं लिखना, क्योंकि social history और medical history तो लिख ही नहीं सकते, because parents will already be knowing about it. तो आपको ये सब नहीं लिखना है. Reason for presenting fell on an outstretched arm, ये सब लिखने की भी जरूरत नहीं. And when you talk about ट्रीटमेंट को भी बहुत ज्यादा नहीं लिखना होता, क्योंकि पेरेंट्स को पता होता है. इसको थोड़ा बहुत आप लिख सकते हो, बट मेजरली यू डोंट हैव टू राइट एनीथिंग. सो अगर मैं ऐसे लेटर का पर्पस लिखता हूँ, तो आप प्लीज समझो एवरी लेटर इज डिफरेंट. सो अगर मुझे ऐसे लेटर का पर्पस लिखना है, तो मैं आपको इसका फॉर्मेट भी बता देता हूँ ओईटी का. एंड ये भी सबसे पहले आप लिखते हो, आप लेटर किसको लिख रहे हो. सो बीइंग नर्स और बीइंग डॉक्टर, सबसे पहले आप लेटर लिखते हो मिस्टर एंड Mrs. Johnson, whatever the name of this, unka address, then you talk about their address, and then you say about date, today's date. So whatever the date has been given, it is given some 3rd November. I'm just taking it this way, whatever has been given, 3rd November 2015. So the day of the discharge, or if it is 4th, then you can put 4th. Then you talk about dear sir, madam, and then you talk about regarding that for whom you are writing. In the letters like this, you will say Master Johnson, because he is a small kid. So Master Sam Johnson, complete name, and then you will mention the age, 9 years. So that is how you do the pattern. So this is very important to understand. This is the pattern. So you will get the recording as well. Then simply this letter is being written. But when you write letters like these, when you are writing to the parents or grandparents, you do not write this line regarding. So this is special in these letters. So simple say, again, the first paragraph is about purpose. So this is a very different letter to understand. So by this also you will learn how to write the purpose. इस letter से भी आपको purpose लिखना आएगा. So this letter is being written regarding your son. So here is the first thing, Master Sam, who was admitted to our hospital due to distal radius fracture. Now, simple, the purpose. Purpose means overall what the letter is. Now after the required treatment, he is better. So he is being discharged. After discharge, yeah, once he reaches home, again, it's just about making it meaningful. Once he reaches home, you are advised to follow few precautions for his speedy recovery. So that's the purpose. That's it. This is how simple OET letter writing is. And if you will see that we have just taken 3 minutes to write all these things. This is the first purpose. Then second, in these kind of letters, you don't have to write social history and medical history, because parents are already known to it. So there is no point of, anyhow, the kid is very small. He's hardly having any condition. So then you simply say, the second paragraph in this letter will become simple. During our care, plaster cast has been applied. Simple has been applied, and it should be kept dry. Give simple instructions by varying your grammar. That's it. It should be kept dry. Again, just say simple things. In case if it gets wet, then hair dryer can be used to dry it. Medications have also been provided, which mainly includes painkillers. Now you don't have to write the name of the medications, because you know parents will not understand the name of medications, though it is simple medications, over the counter medication, so they might know. So in this case you might write, it is up to you, but again there is no particular purpose of writing the medication names. Medication का नाम लिखना जरूरी नहीं होता, प्लीज इस बात को समझो, यही बातें समझने की है. These are the things to be learned. That in OET you write practical things. Parents को medications का ज्यादा नहीं पता होगा, simple, which includes normal painkillers and should be given whenever Master Sammy feels pain. So this is how you write. Then you can mention rest of the points. So I just wanted to tell you the purpose. So I told you it's not gonna take much time. Rest I can let you know over here the letter. So you can talk about these things. He may be sore for several days. So if he's in pain, kindly provide him painkillers, but make sure not to overdose him or not to make him addicted. So you have to take care of these things, that he should not become addicted. And then child can resume his school whenever he feels well enough. Also would like to notify you that his X-ray would be taken after 3 weeks. He can start physical therapy would be started to help him to improve the motion and function of the injured wrist. Cast must be kept dry. So these are the points that you can cover. You can use few bit of connectors if you want, like further this connector can be used along with this can be used, and few more, like just whatever you are comfortable with. Additionally, just you can use these connectors. Otherwise you can simply write also in case this and this. It is also important, this can also be used. It is also important to note. So these are, again, it's very simple. OET is too simple, but at the same time require your patience. Like in the way अभी जैसे आप सुन रहे हो, आप सबको समझ आ रहा है, बस एक ही चीज में एनर्जी लग रही है कि हम सुने या नहीं सुने. बस सुनो. It's very important for you to clear this exam. So please suno. It is also important to note that child can resume his activity. So if you want to write this line, child can resume his light activity such as this within 1 or 2 months. Vigorous activities can be started after 3 to 6 weeks. Also, it is important to be noted that cast will be removed after 6 weeks if there is no complication. And please feel free to write us if you do not understand any advice. So this letter is majorly an advisory letter and will not have much things about these things. तो social history, medical history इसमें नहीं चलेगा. During hospitalization बहुत ज़्यादा नहीं चाहिए होगा इस letter में. So this letter is very simple in its own way, and आपको मैं एक बार दोबारा दिखा देता हूँ in this way. So again, this is how you write. This is Dr. Bhupesh from Dr. BKM Institutes. Now we will start the reading class after 2 minutes, of course, but I will take your doubts in those 2 minutes. So I'm just holding the recording for now. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967342256. Thank you.